Yeah, great. Let's ask the question from YouTube.
Hey Cam, any tactical advice for dealing with trauma? Specifically trauma, the source of which you understand and can interpret.
Yeah, great question, Braden. So the question was around how do you deal with trauma, particularly from a source that you can understand and remember? If you're talking about sort of traditional trauma, so in psychology, we talk about trauma in the DSM as basically a threat to your life or the threat to someone's life very close to you, right? So you like witness someone either harmed or potentially have their life threatened. That's the criteria for PTSD, or what's called post-traumatic stress disorder. I think it's important to differentiate that because unfortunately people throw the word trauma around very willy-nilly. They talk about these micro traumas and things like that. And it's not that like, look, trauma like any other thing, like anxiety is on a spectrum. I agree. But I think people are overusing the term, just like they're overusing the word toxic. In that not everything is a trauma. Just because you encounter difficulty or negative emotion, it's not a trauma. But if it's a serious thing, right? You had a serious adverse childhood event, or in your adulthood, you were threatened in some way that was could have or did result in serious psychological or bodily harm that's continuing to persist. I would say it would be very helpful to pursue sort of a trauma-focused therapy. And the element from all the research that we know that particularly seems to be helpful is kind of what's called exposure therapy. And so whether you do it in the context of a CBT, cognitive behavioral therapy, ACT or ACT, or CPT, cognitive processing therapy, these are all essentially different flavors of therapy. But the commonality or the common thread between all of them is that they're essentially exposure-based therapies. So I used to do this a lot with military veterans who had PTSD, obviously coming back from war or conflicts, often in operations Iraqi freedom, enduring freedom in Iraq and Afghanistan, which are the recent military conflicts that the US engaged in, or even as far back as the Korean or Vietnam Wars. In those instances, exposure-based therapy helps people go back to those instances. They recount them, which obviously brings up a lot of anxiety and stress, but you help reprocess that re-experiencing in a way that over time habituates or extinguishes it. So if someone's going back and telling a story about how their buddy got their arm blown off and it was obviously very traumatizing, it will push them up to like a 9 out of 10 in terms of their stress or anxiety response. But over time, doing it in a controlled way, in a safe space with a trusted therapist, that anxiety will go down from a 9 to an 8 to a 7 to a 6 to a 5 to a 3 to a level that's a lot more manageable and handleable. And that's sort of the magic of exposure therapy. You can even do this in mammals, as I've talked about. Any trauma that can essentially have you learn an anxious or stressed response, you can unlearn through exposure therapy. And so make sure the type of therapy that you're doing is exposure. Another form is called PE, or prolonged exposure, where you have people do this for, let's say, 30 minutes. They tell the story over and over again until their anxiety becomes a little bit more manageable. The latest research shows that you may not need to habituate, at least within the session, in terms of it going from a 9 to, let's say, a 4.5 in order to see the benefit. But over time, in terms of continually recounting the story session after session, it does help people get better and get that habituation extinction over time. You can obviously do that through someone's imagination in terms of closing their eyes and recounting that experience. You can do it through virtual reality nowadays, or you can go out in the real world. So for instance, if someone is uncomfortable with crowds because of their trauma, or driving because of their trauma, then you practice exposure to slowly driving, maybe out of the driveway, around the block. Little by little, you do what's called graduated exposure to start to re-encounter the things that you've been avoiding, because avoidance is essentially the root of what perpetuates trauma or perpetuates sort of the traumatic syndrome, the illness, or what debilitates people. And so re-encountering that really helps people over time. So that's what I would suggest, is if you do have like a clinically significant amount of trauma that obviously comes from the criteria that I stated, working with a therapist that's well-versed in sort of these exposure-based trauma therapies can be particularly helpful.